Hello, everyone. I am Gunjan Veda. I'm Senior Advisor with the Movement for Community-Led Development, and I co-host these calls with Nelly, like she said. So welcome. We're sorry if you didn't have a chance to introduce yourselves you know, on camera, but please do that in the chat box so that we know you are here. Normally, we actually haven't had the time to do introductions in these calls simply because we have way too many people on the calls and the agenda is so packed. But we did want to take this opportunity today when we had a bit of time as we waited for people, and because we are a more intimate group today to do some introductions. So please do introduce yourself in the chat box. Some of you may know, we've had these calls running since April this year, when we began the first call to see how, how do we adapt our own work and programming to this pandemic and all the restrictions that it has imposed on us and on our lives. And since then, we have had a number of calls. And what we wanted to do today really was to take a step back and to reflect a little bit on this journey that we've had for the last 6-7 months together, some of the things that we've learned, to celebrate some of our quick wins, some of our adaptations, because while these have been really challenging times, we've heard from different colleagues, who've actually gone through the COVID experience, who, either themselves or people that they know, and then in their work. So it's been difficult and challenging times for all of us. At the same time, there have been wins. We've seen how globally people are talking more about community-led development. We've seen how we have and communities have come up with solutions and have rapidly adapted. So this call really for us was, a place where we wanted to reflect over what's happened in the last 7 months, share with each other some things that have worked for us, in our brainstorming groups, and then really to talk about some of our next steps. So the agenda today is simply going through what was done, reflecting. We will hear from 3 different countries, Uganda, Zambia, and Nigeria, about...
Yeah.
Sorry. Okay. Yeah, so we're going to hear from 3 countries, Uganda, Zambia, and Nigeria, about how they had to adapt their own work. We are going to go into breakout groups after that, where we can discuss a little more and share more about what worked and what did not work for us. Where did we need to make, where do we still need to find solutions and brainstorm together? Where do we still need initiatives that have to be joint and collaborative to kind of, move to the next phase? And then, as some of you may know, we actually started a COVID working group earlier this year. The members of the COVID working group have been meeting regularly every 2 weeks, and we're going to hear an update from them about what's been happening with the working group, where are we at with the research that they have been doing. And finally, we have a couple of ideas on the next step, and we're going to talk about that. So that's really is the agenda for today's call. As always, please use the chat to share your thoughts, ideas, anything that you want to say. These calls essentially are your calls, and we've only been doing them because every time we've said, should we discontinue, we've heard everybody say, no, we want to have these spaces where we can talk and brainstorm. And especially because we are a much more intimate group today, feel free to raise your hands, and one of my colleagues, and John, Nelly, one of us will keep track of who wants to speak and make sure that you're heard. So Nelly, over to you.
Sure thing. And John, do you mind moving to the next slide? So as we said, we've been doing this for a long time, both that this pandemic has been going on for a long time, and there's been a lot of changes over the course of time, but also that we as a community have been together for a long time. And looking at some of the folks that are in this room, there are some of you who have been here from the very first meeting back in April. So we just wanted to, in order to enable us to sort of remember everything that we've gone through, run through what the calls have been. This is our 7th call. So very quickly, if you remember, the goal from the very beginning was, how can we, in the context of this pandemic, maintain, and not only just maintain, but strengthen and adapt our programming so that it could continue throughout the pandemic, because so much of the work that CLD does is actually is still important, and if not more important during the pandemic, but a lot of the mechanisms that we use and sort of priorities, immediate priorities perhaps, were constrained by the pandemic. So back in April, everything was still very fresh. There was a lot of uncertainty, and we started by looking at 4 barriers: a lack of access in terms of mobility restrictions, being able to travel to communities, fear and inability to convene, that, you know, both there were restrictions that prevented it, but also it was, we didn't understand how the virus spread, and we knew we couldn't convene in large groups, challenges to procurement and delivery because of all of the disruptions, and then how people's available time and priorities were changing, and whether that meant that they were going to, you know, be able to participate in the same way in CLD. In April, we were already seeing in some places that lockdowns are easing, which is sort of hard to imagine. And we thought about what would it be like to resume programming in 6 to 10 weeks. And also, you know, how could this help us to be better prepared the next time? How could this help us have stronger programming in the longer term? In June, we did a very technical exercise of scenario planning, looking a little further ahead, imagining in 3 months a number of different scenarios for what it could look like, and looked at a few imagined organizations to try to think about how those organizations could respond to different circumstances. That exercise was also important because it was we hope that it would be a tool that participants on the call could bring back to their own organizations and use as a planning tool. In July, we talked about trust and how trust had been disrupted by the pandemic, when, you know, you couldn't go and work, and communication was hard, and perhaps delivery of things that, you know, communities expected was interrupted, but how that trust could be maintained. And we heard 2 stories from the field, from DRC and from Guatemala. Then in August, we were anticipating the September call, which was for the UN General Assembly, and we looked at how collaboration had been with local and national governments in different countries. And we also, again, heard from 3 different organizations working in different contexts around the globe, excuse me. September, our last call, was very different because we didn't have a meeting like this. Instead, there was a high-level panel for the UN General Assembly that the movement hosted, and where we got to hear from the international level, the national level, and the local level of how different actors were working and collaborating. And then, as Gunjan said, this week, this month, we're gonna take a step back and reflect a little bit both on the challenges and the successes that we've had, and also just how long and tiring it's been. The meeting notes and recordings for all of these sessions are on the movement website also. So if anybody ever wants to go back and look at them, all of that is available. And all of the tools and ideas that we have are available. And that's compiling some of those stories as part of what the working group is doing. If you could go to the next slide, please, John, and Gunjan, over to you. Oh, you're on mute.
Sorry, can you hear me now?
Yes.
Yeah. In one of our first few calls, we heard Pascal from the, from Benin talk about how the Benin chapter of the movement had started thinking about and coming up with, information plans, helping people in the COVID times. And one of the things that they had said, which we kind of tend to forget, is that how important it is for each of us to take care of ourselves, even as we continue our work. And that's something that we wanted to I know our calls, as you would have seen from the quick walkthrough that Nelly just did, our calls have really been content focused till now. We've really talked about programming, we've grappled with issues, we've spoken to specific problems we've had to resolve, and brainstormed around specific solutions to try and do that. So we've done a lot of work over the last few months on our, on the professional front. And that's important. And we're going to continue to do that. But we did want to take today a couple of minutes to check in and also see how we're doing personally, because this pandemic has been difficult. A lot of us, we spoke about how our communities, people are tired, they're exhausted, constantly having to grapple with these issues, but so are we. And we just wanted to, even before we get into the content part today, we wanted to see if anybody wants to share, talk to about what has the pandemic meant for them. What is it that they're going through? And I can start by saying that I think for me, on one hand, well, luckily I was not in the field. So I didn't have to grapple with that immediate thing of how do I maintain contact? How do I do this evaluation project? How do I didn't have to deal with that every day. But I did get to see professionally a lot of the great things which are happening on CLD. Everybody was suddenly talking about CND. Workload increased, but it was very exciting because finally you were like, aha, now people see why communities are so important. Yet personally, it was exhausting. It was really, really exhausting just trying to deal with everything, because I moved countries in the middle of the pandemic. And it's not easy to be in a new place where you suddenly don't know anybody and cannot know anybody because of restrictions. But if anybody else wants to share a little bit about what COVID has been for them, and you can also put in the chat box, maybe, just how are you feeling?
And to add on, I think also, even if people don't want to share, I see Dr. Rebecca would like to, but just to say that even if people don't want to share here, I think it's just an important thing to kind of sit back and take a moment for yourself and reflect on how long it's been and how much personal and professional one has been through. I think it's interesting how the world went on pause, but I think for many of us, our work got even busier, and that's can sometimes be hard to integrate. Dr. Rebecca?
Yes, this COVID affected me personally, my family members, several, my children, two of my children, my grandchildren, in-laws, and were contacted. And even one of my daughter was on oxygen. And we too, we are here, not together with them. We have our mother at home who is very old and all this. So, and then some of my staff too were contacted. And some went to court case when they were infected, they don't know. And all this, it was heavy burden on me personally. And but I thank God for the support of this community, and a lot of people. They helped me both a lot of things. So, and even in Nigeria, the community-led development prayed, and so I had the support of a lot of people. So I really appreciate. And I'm also living here in a fear because I'm among the old people, and it's very scary. So it's a scary moment.
Yes.
For me personally.
Thank you, Dr. Rebecca, for sharing. And thank you for also, I think Thank you for taking that first step. I think all we wanted to do today with this was actually to say that we feel as a practice, we should, in every call that we do now, even though we'll have this packed program content agenda and we will be going through that, we do want to take that time in every call to at least just recognize what is it that we are going through as well, and to take that minute to congratulate ourselves on the fact that we have come so far, and despite everything, we are where we are. So thank you for doing that. That was brave. I don't think it's easy. I think it's very easy for all of us to talk about our professional lives and our work. It's very difficult to speak about what we are going through. But with that, I want to move on to the content part of it and hope that we will continue this tradition. Not the next slide, John. Not yet. So no, go back. Sorry. Can we have a poll, Izzy, the first poll? We wanted to check a little bit about now what's happening with our work. So if you could quickly take a minute to just input your responses to the poll that you see on the screen. Okay. The reason we wanted to do this poll, and we did this today again, was that this was a question that we started asking ourselves. This is a question we started our COVID calls with in April. This is what brought us together. What is happening on the ground, and how are we reacting to it? And it's interesting because now we see, well, has everybody put in their responses? Should we end polling?
Yeah,
I have 16, 17 out of 25. So we have about 70% of people voted. So
I think all people who we make into host and co-host to facilitate and help us with this process don't get to vote. Sorry about that.
Okay.
Okay. So the reason we wanted to see this today and ask this question again was because sometimes it's easy to forget. Time moves so quickly and so much has happened that it's very easy to forget what was it that made us start this. You know, I think today we have 29% people saying that they did not need to pause or alter their work. Let's see what happened in April. John, if we can move to the next screen, please. So actually, it's not that different. That's interesting. We had 21% people in April who actually said they didn't have to change what they were doing, and 79% people who said they had to actually alter and pause their work. So similar numbers, I would say. But we wanted to see if we have forgotten how crazy those times were. Can we launch the next poll, please? Okay, it's been 7 months. Most countries went through rounds of lockdown, and then the lockdowns were removed, were lifted. Some are going back into lockdowns. What is happening now with your programming? It's interesting because I think this is also the first call where we've allowed ourselves, I just realized, to actually take a step back and just get breathing space. Otherwise, normally we run polls in the background even as we do slides and take people through. So this is also a deliberate, I think, experimentation on our part this time to see that should we be having more breathing space in between calls. instead of functioning on an autopilot. Izzy, do we want to end the poll? So if you haven't voted, vote immediately, otherwise the poll ends now.
Okay.
So for most of us, well, few people have been able to go back to regular pre-pandemic programming, and I think it's going to be very interesting in the breakout groups to actually hear from people who've gone back to regular pre-pandemic programming, of how they were able to do that and what was it that allowed them to do that. I think for most people, it's either been that they've had to adapt their programming, or they've had to make long-term changes, or they're still not able to operate. And that's interesting too, because I think what that points to is, again, a discussion we will have in the breakout groups of what is it that we need to do next? What do we need to address? What still remains to be done? And how can we as a group work together to support each other to maybe face some of those challenges going forward? Okay, we will have our final poll now. Thanks, Izzy. In April and May, when we first started these calls, we heard from people about some of the key challenges they were facing. What were the areas that were the most painful in terms of the lockdowns and the social distancing? So we want to understand which are these areas that we've been able to address and find solutions and answers to, and which are the issues that we continue to face problems with. So if people...
I think this is a harder question to answer, maybe.
It is, because you kind of need to think through what is it that we have been able to do and not been able to do. But again, the idea is just to get a general sense. And when we hear from our participants going forward, we'll have three colleagues from different countries sharing their own experience. Some of this is going to become clearer, but we wanted to see if there are areas which continue to be more challenging than the others. For instance, I don't know how many monitoring and evaluation people are currently on the call, but I really wonder how much people have been able to resume some of that. Because I remember in April, we heard a lot of people say that, the priority at that time was not monitoring and evaluation. The priority at that time was not research. It was just somehow getting people what they needed. Okay, do we want to end the polls now, Izzy, so that we can see what people's responses are? Thank you. So what areas have you adapted most during the pandemic? Community mobilization and meetings. Well, that's not surprising. I think what would be interesting to hear in the breakout groups is that, have you been able to adapt, and how people have been able to still do this work? Because we've heard in earlier calls how this has been a challenge. And then the next most thing that people adapted to was fundraising and communications with partners and communities. Well, monitoring and evaluation saw the least adaptation. And what are the areas where we continue to face difficulties in? Here again, community mobilization is the highest. So that's interesting. I think the areas people said that they have been able to adapt most are also the areas where they say that we continue to face the most challenges. So again, I think we're going to have some very interesting discussions in the breakout groups to actually hear specific examples or strategies that people have used around this. So because we did take the time for introductions today, we are short on time. So I'm going to end now and hand over to Nelly so that we can hear from our speakers. But again, this was just for us to have an overview of what's happening, so that in the breakout groups, we can delve deeper into some of these issues to see exactly what was done in these areas for each of us. Nelly, over to you.
Thank you. Yes, and to lead us there, we're going to hear from 3 speakers. I'm just seeing whether Deanne is on here. I think she may have popped off. So first, I'm going to turn over to Akelo Emma Grace, who we actually heard from in that very first phone call back in April. Emma is a community of practice manager based in Kampala, Uganda, working with Spark microgrants. John, if you don't mind actually going to the next slide also. And Emma is a social worker by profession, and she's worked with different communities across Uganda over the past 10 years. So with that, Emma, can I hand it over to you and give you 3 minutes, and I apologize in advance if I cut you off.
Oh, thank you so much, Nelly. Thank you, everyone. And apologies, I can't open my video because my network is not so great. Yeah, just to share a bit on how we've adapted to COVID-19 since the last time we spoke. Just to be very specific on some areas is, as an organization, I think we had to change a lot in our focus, in our focus for setting goals. So before the pandemic, we had very clear 2020 goals, but we really had to change focus and set very short-term COVID-specific and related goals. So we even had to turn to monthly goal setting versus the quarterly goal setting, and this was mainly to allow for uncertainties. And I think something that we also did that we had never done before is Spark Microgrants gives small grants to communities. So it's a one-time seed grant. But with COVID, we had to adapt, learn how communities are struggling, and we did some fundraising and disbursed a COVID top-up to over 159 communities across Uganda, Rwanda, and Burundi. And most of these COVID top-up funds, communities were able to use it for farming, boosting their village savings schemes, and also for health insurance in Rwanda. This was very much appreciated because the community saw it not only as a support mechanism during the hard times, but also as a cohesive tool that brought them again to plan together during such hardship. I think something that we've also learned that we can get better at doing is providing remote training. And right now what we are doing is kind of reviewing the existing tools that we have, but also looking at other materials that we can build on to be strong at training our partners remotely. Then we've also become very strong remote teams. We are working in different parts of the world, and we are strong together. We've adapted to so many systems that keeps us together, such as daily stand-ups, team meetings, and weekly check-ins to just remain accountable. And something also very interesting that I shared in the previous call is that we also very quickly as an organization developed a reserve fund policy that will help us over time to manage crisis. Yeah, and maybe in the other area on how we've related with communities, we introduced small group meetings as opposed to the large community meetings. And these small groups allow 10 people in Uganda and over 20 people in Rwanda and Burundi, where community members still meet while strictly monitoring the SOPs and continued to plan. And interestingly, we've had very high attendance in these meetings. Over 90 people attend in the small groups. And something that the communities have also continued with us for checking in, the phone calls. And another interesting thing that we also learned during this time is that the community-based facilitator structure is something that can be strengthened really, really hard to manage all community activities on ground. So during COVID, we immediately had to empower the CBF to take on so many other responsibilities like leadership and reporting, and they were able to do that really greatly. And as lockdown is partially getting lifted, we are assessing their capacity and seeing how much more training they need to be able to do this with high level of confidence.
Perfect.
I think that is very briefly what I can share as some learnings and adaptations.
So much. Thank you very much. With that, I'm going to then turn it over to Umuno Mwiba Chongo. I apologize for mispronouncing that part of your name. Umuno is with Amos Youth Center, which is a local NGO in Zambia, and it's provides sponsorships for grade 8 all the way through college and university, and it runs a youth center which provides free tuitions, clubs, lunch to local pupils. I hope I'm not taking away from your presentation, but over to you for 3 minutes. Thank you.
Thank you so much. Don't worry about the name. It's fine. I totally understand. So I'll quickly just go through some of the challenges that we have faced and how the center ran before COVID hit. So that everybody has a clear picture of how we run our youth center. So in a day, we would receive about 400 pupils, about 100 in the morning that would release to go back home at around 10:30. Then the 300 usually come from about 12:30 to 17 hours. So we offer free tuitions to them. We give them lunch, and they come for different clubs. And we also offer counseling services. We help them with their assignments and school-related programs. So after the pandemic hit, we had to close down because looking at the number that we were hosting per day, that was a big risk to continue operating and offering our services to the children. So we closed down in March, and 3 weeks after that, we had to prepare a food pack for the families just to ensure that our kids are safely indoors. So we gave out a food pack to 275 families, and we started our weekly health calls. So in our health calls, we get to ask the families how they are doing. Is anybody running a fever? Any symptoms of COVID, just to make sure that all the families are staying safe. And we made sure we shared all the information we knew about COVID, and we did this in our own local languages so that every person should understand. We also called our pupils who were in examination classes. So we started with those who were in examination classes. We taught them over the phone just to make sure that they are up to date with their schoolwork. We printed out some educational packs which we handed out safely to them. And currently we are working on applications for next year's scholarships. So we're going door to door for the kids to apply. Some of the challenges that we have faced is that we are concerned about the quality of education that our kids are currently receiving, because we are able to meet them and see how they are performing in class and give them those free tuitions. And also, are they being safe? We are trying to organize some protective gear for them. Hopefully we'll have enough funding for that, just to make sure our kids are safe. And also, we are unable to continue with the feeding program because currently the center has been closed. So that's just one of the challenges that we're facing, because we don't know how much our kids are eating, looking that we cater to very vulnerable kids in the community. We have been unable to give a second round of food due to funding, but we are working so hard for us to be able to give our beneficiaries some food to help them during this very hard time. Thank you so much.
Thank you. Sorry to cut you off. Oh, we just had Deanne. And it looks like she may have just dropped off. As Dr. Rebecca said, there are protests going on all across Nigeria, and that may be affecting connectivity.
So we recognize that one of the big values that we've constantly heard from all of you about these calls is the time that we get to actually work in breakout groups to, more intimate settings when we can speak to specific issues and specific challenges and strategies we have used. So today's breakout discussions, we are going to have 3 breakout rooms. There are no facilitators that have been assigned. So please, this is the opportunity to also facilitate and be a part of this discussion. Please volunteer in your groups if you are interested in facilitating. Every group has a note taker. The note taker will have a screen with the questions that would help guide the discussion for everyone to fill in. And we ask that when you come back, you don't need to share the summary, just one key takeaway, one idea, one problem, one solution that has, that has stuck with you. I think that would be very, very helpful. We'll have 25 minutes, not 30, for the breakout groups, just in the interest of time. But the questions really today are about thinking through what's changed between April and now. What adaptations have you had to make? Do you feel because of those adaptations, you're better prepared for a second wave? Because we hear in many of the countries that there may be a tightening of restrictions again. So do you think that those adaptations have made you better prepared for it? And what are some of the areas that remained in terms of challenges so that we can pick them up going forward? So each of the Excel sheets will have these guiding questions to help the discussion.
I'm looking around the world from Ohio, US, and I see an opportunity with the movements that have already happened within USAID, but there needs to be a collective voice that is sharing the success stories really from the NGOs and community-led development organizations around the world, and get the attention of the funders, the partnership builders, because the time is now, and being a voice, I think, is really, really important right now, because there's been amazing work done on the local level by some very small organizations who have put their heart and soul into what they've done.
Great, thanks,
Yeah.
Kat.
Thank you both. Yeah, I think networks like this to elevate and expand the learning and the impact of these groups is something we were sort of talking about in group 2 at the very end also. Anne, would you or anyone else from group 2 like to share a takeaway?
Well, echoing Pat's point, so I won't say it again. And to give a specific example, Spark in Uganda has broken their normally larger groups down into groups of 10, and so that they can be COVID sensitive and COVID safe. And there's an idea too that these smaller groups of 10 are having a certain level of effectiveness that was unexpectedly maybe even more powerful than the larger groups meetings of 90. So there's the possibility of keeping that structure after COVID, as so this has been a good chance to experiment and see some new things that might be better after COVID as a result of COVID.
Thanks, Anne. From group 3, anyone who'd like to share a takeaway?
Arthur did a wonderful job of facilitating, and I think would also be up for sharing out. We volunteered him at the end.
So, was that me?
Yes, I tagged you in, Arthur.
Okay. All right. Well, I wish, is there a way to get the Excel spreadsheet? Because I was just going through and facilitating. If I can get that up on the screen, then I can go through it with the rest of the larger group.
Yep. Chris is putting it up now. Do you see it, Arthur? You're muted.
Yes, I do. Thank you. All right. So thank you for putting this up, Chris. Really appreciate it. So first thing is, we were looking at the current situation, and we had members from the group just talking about some of the things in terms of what is different from today. Couple of points is that we are now working remotely. When in some countries, like for example, we talked about Malawi, the government had shut down schools and we didn't really have a strategy on how to continue working with schools, some NGOs. And based on that, we needed to figure out how do we continue to work with students who have left school after government closes them. In other areas, we looked at adapting SOPs to COVID and reawakening of the community spirit, just to keep going, looking at alternative funding, but also people longer strictly observing SOPs, which was a big problem. And we had to make sure that we talk to people about observing curfews. The death rates were going up. So a number of things have changed in terms of the situation, which are different from April. In adaptations, a couple of things that we've learned from that is community mobilization. I believe I heard Anne talking earlier about breaking down things into smaller groups. And that's also similar to what we were talking about. Breaking them into groups of 10 has been more effective. We've moved to, other countries have moved to online and phone education instead of in-person classes, and no more big meetings. So I think that's a general consensus through most of the countries. In terms of preparedness for the second wave, there are other countries that are currently encouraging members to participate in district task forces to influence resources from government, from CSOs. But also in other countries, we've seen that because the cases are not as high, people are becoming a little bit more relaxed. And this is a concern. So there's need to continue providing messages of social distancing and face masks and sanitization. And going into the other area here, which is further planning, we as a group discussed that we needed to look at fundraising as key, because this is an area that, of course, has changed many NGOs or local NGOs in their approach in community-led development. And we needed to look at this as a key area, which still remains to be done. I'll stop there. Thank you. And if my other colleagues have any comments, please feel free to add.
Thanks, Arthur. And yeah, if anyone else has any takeaways that they'd like to put in the chat box, please do. John, do you mind putting the slides back up just for the last 5 minutes? Before we close, we wanted to just get an update from the working group, which stemmed out of this series of calls a couple of months ago, and they've been meeting about every 2 weeks to think about how to take some of the stories and information and ideas from these calls and dig deeper into them and spread them further. So Annette, do you want to, unfortunately we just have 2 minutes, take 2 minutes to share where the working group is now and what's coming next?
Yes, absolutely. We have decided among the working group to go with interviews among our organizations. A couple of our organizations have already conducted the interviews. We've been trying to arrive at good interview questions, eventually putting them into an interview guide.
Oops, seems like we lost you there. Okay, there, we got you back.
Oh,
We just,
can you hear me now?
we missed,
Sorry.
Now we hear you, yeah. We missed a couple,
Okay.
a sentence.
Okay, don't know where I was before, but we have a lot of survey data, interview data, stories, to which everyone here at this meeting is welcome to contribute. So you can reach out to probably Gunjan or Nellie. And I see my internet connection is unstable. So can you hear what I'm saying?
Yep, we hear you.
Okay, great. So we have, as I was saying before, we have a lot of different circumstances in our organizations. So we're trying to come up with questions that will address each of us by being broad, but also be able to contextualize within those questions what the different circumstances might be.
Great, thank you, Annette. Yeah, so exactly, the working group is working to take some of this, build on some of the stories that we've heard here and get deeper information from different organizations, both by collecting sort of quantitative data or data that's been collected through surveys that other organizations may have done, and by doing some interviews through the communities and community level facilitators that are in our network. So if anybody has anything to contribute there, please let us know. I see that Matt has their hand raised. So if you want to just quickly go ahead, and then we can hear from you, and then we can close
thank you
the
very much.
conversation.
Okay, thank you very much. My name is Mate from Uganda. I'm glad to be here. Okay, during COVID-19 and also after, of course, opening up some of the things in Uganda, we have been able to carry out an assessment on gender-based violence prevention and COVID-19 effects in Uganda. We have been carrying this one out in all the regions of Uganda, the north, the eastern, the central, as well as the western Uganda. And we are yet, of course, to publish our reports that we have been able to compile. I know the team is working very hard to ensure that at least we have the report out and also shared with various members. I'm yet to, of course, finalize something with Anne, Hendrik. We shall be able to share some of the highlights on what key issues, maybe if we have missed something in it, because we know that the pandemic has affected most of the communities that we are working with. And most of the voices in these communities have not been heard. So what we had to do is to go ahead and collect feedback from them so that we ensure that these feedbacks we get don't just end on paper, but also shared on the international level, bit on the national coalitions, so that something is done at the end of the day. Thank you very much.
Thank you so much. And that's exactly what we are hoping for. If you're doing things like that, and whenever you feel ready to share it, or whatever parts of it that you're ready to share, I think the working group, and there's a few folks who are in the working group on the call today, I think they'd be really interested to see it and see how these different efforts can all work together. So with that, 3 minutes, I'll just close up. John, if you could go to the very last slide. We mentioned that last month there was a panel at the UN General Assembly. There are key takeaways from that up on the website, the MCLD website. The link is right there on the call. Again, if you have anything that you'd like to share or contribute to the working group, please reach out to Gunjan, myself, or John. As always, if you want to join the movement's mailing list and you are not already on there, where you can find out upcoming calls, materials, sharing resources, you can subscribe on that link. And then the last thing is, as we mentioned, and as hopefully the progression of calls kind of demonstrates, as we're trying to be adaptive with these calls and always plan the next one based on the changing dynamics and needs that are going on globally. Part of that is always making sure that these calls are still relevant and useful. We are committed to keeping them going as long as you all want them to happen, but we don't want to take time away from everyone's day, even just once a month, if they aren't useful. So always give us feedback on that. For the next call, we've been having a number of discussions with people about vaccines. It seemed like that would be very far away, but in fact, there may be some that are available really soon, and there's a lot of issues around that. There's questions about the safety of them, the regulations that they will have gone through, how you spread information about them, about who will have access to it, whether certain countries are going to sort of buy them up, and how we get them to communities, how people can determine if it's safe for them, how they know it's available, how they are able to actually get them, and how community-led development and CLD organizations can support that and be prepared for that, which seems like it may be soon. So if you have ideas for this or would like to speak to this particular theme, if it's something that you and your organization and the communities you work with have started to address and think about, please let us know. And with that, we're at noon, 12 p.m. Here on the East Coast of the US. So thank you all so much for joining. We really appreciate it. And it was nice to have a slightly smaller group this time.